Another cranial bone is the sphenoid bone. And the sphenoid bone is a very special cranial bone because it is the only cranial bone that touches all other cranial bones. If you look right here, this is the sphenoid bone. It touches the frontal bone, it touches the ethmoid bone, it touches the temporal bones, the parietal bones, and also the occipital bone. So it is the only cranial bone that touches all other cranial bones. And because of that, it is called the keystone because it basically keeps it all together. Now, we have several bone features in the sphenoid bone, and you need to know them all. When we look at this anterior view of the skull, we can see that the sphenoid bone also is part of the bony orbit. And if we zoom in, we see an elongated hole, and an elongated hole is named fissure. This fissure is in the superior aspect of the bony orbit. Consequently, this is named superior orbital fissure of the sphenoid bone. Also, we have an elongated hole in the inferior aspect of the bony orbit. And this elongated hole is made by the sphenoid bone and also the maxilla bone. Since this is an elongated hole, it is a fissure. It is a fissure in the inferior aspect of the bony orbit. Consequently, this was named inferior orbital fissure, and the inferior orbital fissure is a shared feature between the sphenoid bone and the maxilla bone. Now, sometimes students get confused if they have the supraorbital or the superior orbital. And the way I tell students to remember is by remembering that a hole, a foramen, is short, and a fissure is an elongated hole. Consequently, for the fissure, you need to write the entire word, superior and inferior orbital fissure. And for the hole, you just write the short version, the supraorbital foramen and the infraorbital foramen. Now, looking back in the bony orbit, we see a canal. And through this canal, we have cranial nerve number 2, the optic nerve, passing. Consequently, this canal is named optic canal of the sphenoid bone. And when we look inside the skull from a superior view, we can see here the optic canal, the right and left optical canals. We can also see from a superior view other bone features that belong to the sphenoid bone. We see here the sella turcica of the sphenoid bone. And the sella turcica was named sella turcica because it resembled the horse saddle used by some Turkish people old days. Now, the sella turcica is very important because it houses the pituitary gland. So it's literally a little house, a little bony house for the pituitary gland, which is the major endocrine gland in our body. So we have the sella turcica of the sphenoid bone. We also have these 3 holes. And from anterior to posterior, these 3 holes are Ross. We have foramen rotundum, foramen ovale, and foramen spinosum. Obviously, the foramen ovale is the one that has an oval shape. And these holes serve as passageways for some of the branches of cranial nerve number 5, the trigeminal nerve.